So I'm delighted to be talking to Dr. Dan Dworkis today. He's an emergency medicine doctor at LA County Hospital in Los Angeles, California. Dan is assistant professor of emergency medicine at the Keck School of Medicine, which is part of the University of Southern California. And he's also founder of the Emergency Mind podcast, which looks at performance under pressure and including how to train your mind for halo procedures. So welcome to our conference, Dan. Really, really delighted to have you with us today.
Thanks so much for having me. I'm sorry I can't be there in person to work with you all. It sounds like an amazing group, and I'm looking forward to hearing how this goes.
Perhaps we could start with a little bit about why you became interested in this topic of the psychological aspect of performing under pressure.
Yeah, absolutely. And I'll tell you, it wasn't halo procedures, right? Like I didn't even really know what a halo procedure was when I was at the point where I was thinking about this. It was actually the run-of-the-mill basic stuff that really got me, right? It's the idea that you can walk into a room, have all of this knowledge in your head about how to handle an emergency, and then run into such trouble getting that knowledge from your head to your hands. And you look around at people, and some of them seem to be able to do it easily. And some of them, like me, when I started, were really struggling with it. And so you're left with this question of it's not enough to know the knowledge. You have to cross the idea of getting that knowledge from your head to the patient where and when they need it. And that was super fascinating to me, right? Because I had a real parallel track, which is I'd been learning martial arts since I was a little kid. And it's a very similar problem, right? Martial arts, you learn a technique, you learn a, wrist lock or ankle lock or whatever. And then you try to figure out how to apply that in the middle of a match. And it's just a very different universe. In both cases, you have an idea and then you have to apply that idea under pressure. So that became sort of endlessly fascinating to me. And I think halo procedures are a really natural outshot of that, because no matter how trained you are, these are things that pretty much by their nature, you're only going to encounter a really few number of times, if at all, during your career. But when they come up, you have to be ready right then and there to deliver that knowledge.
And so how do you get to that point where you are ready to perform when you need to, when you don't have that much experience, in your day-to-day job?
Yeah, that's the $1 million question, right? So there's a lot of pieces in that. And we can sort of divide them into the person, the team, and the organization. And these are the different levels that we tend to approach a thing like that, right? So if we want a halo procedure to go well, we have to work on ourselves as a person, our ability to do the technique, our ability to buffer pressure, our ability to train for it. And that's where we're mostly going to focus today in this conversation, right? About the idea of mental simulation as an accelerant for being ready to go for halo procedures. But you also want to think about your team, right? What are the people around you? How are they going to help you actually help or harm you in your ability to actually do a procedure? And then the organization, which is everything from what's the setup in the room, what's the shape of the space you're working in, do you have the right supplies? Are they ready to go? All of the stuff that happens around you that enables you to actually do this technique. But if we kind of zoom into ourselves for a moment, we stay on the individual level. Again, we can split into the knowledge. Do we, at least in theory, know how to do the halo technique, right? Because if we don't know how to do it at all, then that's our first stop, right? We're going to stop there. We're going to learn the technique slowly. Then we're going to start thinking about how to buffer pressure. And then we're going to smash those two things together where we're thinking about doing the technique under pressure. And we can sort of dance around that for a lot of stuff. But I think the idea of what we're going to talk about today is this idea of mental simulation or visualization, right? So a lot of us, when we start learning, we have access to wonderful facilities. We have sim labs. We have people teaching us. We have people that are there guiding us. But for most of our careers, that's not what the universe looks like, right? We're not accessing sim labs. We're not accessing people that are better than us at techniques. A lot of this learning is directed by ourselves for ourselves. What we do have, what we always have, is our access to our mental simulation lab, right? Which is sort of like a, kind of a corny way to say it, but actually like pretty cool that we can actually do all this stuff in our mind over and over again. And so we can use really detailed approaches through visualization to help us figure out how to buffer pressure, to help us figure out what to learn next, to redesign the spaces around us, and to really improve our chances at succeeding at a halo procedure.
I mean, I think that's absolutely right. And I think it's really, really interesting and reassuring to realize that actually probably the highest fidelity simulator that you have is your own mind, and it's free, because I think a lot of people feel like, to do these um dramatic procedures, you have to have been on a high sim course, paid thousands
Mm-hmm.
of pounds to
Mm-hmm.
do that, and that's just not tenable for most people to do that on a regular basis. But
Right.
actually, from what you're saying, that's not necessarily the way to go. Actually, you can probably do a lot of the training at a very low cost using your own mental simulator that you have 24/7 access to.
Absolutely. Now, if I had access to a dedicated sim lab all the time with a huge staff and resources to train in it, that would be awesome, right? And we just don't typically have that. So most of the time we want to make do with what we have. And what we always have is our ability to mentally simulate things. So the goal here is to sort of supercharge our ability to do that and allow us to really leverage that and use it to improve ourselves. What this means really is that we're not going to think about it not just as kind of vaguely thinking something through or like doing some hand wavy mental motions, but we're going to get into really what it takes to make this work as a technique. So maybe it's worth tossing out an example to anchor us a little bit, if that's okay. And one of the techniques that I know you all are going to be working on today is surgical front of the neck access, or doing a cricothyrotomy. And if it's all right with you, I'd like to focus on that one, because I think that's like one of the easiest ones to visualize out of the list. It has kind of the fewest steps, and it's really tactile and something we can really get into.
Sure.
And it's worth exploring what do we even mean when we're saying mentally simulating, right? So if I was in front of you, what I would ask is for a show of hands of who does mental rehearsal of this technique over and over again. I obviously can't see how many people are raising their hands, but I'm hoping most of them would say yes, they do some sort of mental rehearsal for that. And I think that's a baseline. At the beginning, your first pass is really just, can you think through all of the steps of the procedure? Can you reach what is essentially an 80% solution? Can you basically get it right? And if you find yourself thinking through the steps of it and you're like, yeah, okay, I understand, like my left hand does this and my right hand does this, and here's what the scalpel finger bougie technique sort of looks like. Okay, so you have a good baseline to work with. If you don't have that, if you can't mentally walk your way through the procedure at an ultra high level, then really you need to stop and go back and train that. And whether that's watching YouTube videos or reading or talking to people that have done it, that's sort of your first job, right? So at a baseline, these mental simulations, these broad brushstrokes, help you figure out where you need to focus your baseline energy, right? And you could imagine, okay, let's say, I'm not sure how many procedures emergency doctors need to do, or what's the complete list of Halo procedures. I'm not sure anybody's ever built that. But if you imagine going into a shift and you're like, okay, well, what are the things that I might need to do today? And you can sort of high level zoom through all of them. My guess is some of them will stand out to you as more sharp than others, right? And that's one of the things we want to look at when we think about mental simulation. How sharp is the mental picture that we're building? And specifically, how sharp is it compared to other mental pictures that we build, right? So if you take something that's easy, that you know how to do all the time, that could be as simple as, opening the front door to your house, walking in, and what that looks like. Or that could be a medical procedure that you do pretty frequently that's not a Halo procedure, something like putting a central line in or suturing up a laceration, right? That's your baseline, something you know really well. How sharp is that mental picture in your mind? Okay, so then you look at your Halo procedure from a high level. Is that visualization as sharp as the one that you know really well? If so, great, you're ready to move on to the next thing. And if not, all right, you probably need to zoom in a little bit on that and sort of do more training. Does that make sense?
Yeah, and I think people often are a little fuzzy around the edges. It's the detail, isn't it? That's the devil is in the detail. And
Right.
I think it's very easy to breeze through and say, and think that you know something, but actually, when you focus on, do I really know exactly what this feels like?
Mm-hmm.
Where is my equipment? What do I need? What size of equipment do I need? What help do I need? That's when you know all of that. That's when you can say that you really know what you're doing.
Yeah, and I think you nailed it. The devil really is in the details in that, right? So as you're doing your visualization, like first, is it overall fuzzy or sharp? Great. And then your next thought is, within that, as I step sequentially through everything, what feels different than the other pieces? Okay, so two clues we can think about when we're looking at different in this case, and a lot of this comes from Kristen Allen, who's a gold medal gymnast, who talks about this when she's visualizing in her mind her tumbling routines, right? So her long like series of acrobatics. So one is, which piece feels slightly fuzzier than others? Okay, again, this fuzzy idea. So as you're going through putting a chest tube in, right? Maybe finding the landmarks is really sharp, making the initial decision is really sharp. And then you're just like a little fuzzy about how to hold the Kellys in your right hand in order to get in there. But then the next part feels really sharp again. Okay, well, that difference, that step function in clarity is a great signal. That's where you need to spend your time training. Another example is where you shift from first person to third person points of view. So when you're visualizing doing a procedure, most of the time you want to be visualizing in first person from your eyes. What are your eyes seeing? What are your hands feeling? Where is your body? What's going on around you? If you find at some point that you've been kicked out of first person and are now watching yourself do the procedure, that's probably a subtle hint that that step is something you need to go back and really focus on.
Yeah, that's really good. That's a really good tip, actually. And I think one of the other things that sort of inhibits our ability to have that sharp focus is pressure. You know,
Mhm.
under pressure, our minds behave very differently, don't they?
Of course.
And learning how to perform well under pressure is often something that's just assumed you will pick up as you go along, as you gain more experience. It's not something that's sort of overtly, explicitly taught. And I wondered whether you had any tips on how to manage those high acuity situations when you are sort of under that pressure, how to keep your mental model sharp as you're preparing to do what you need to do.
Absolutely. So you're totally right. Pressure hits all of us. Doesn't matter who you are. Pressure hits all of us in some way or another. Conversely, nobody is born being able to totally handle pressure, right? You know, like I have delivered babies. I'm sure you delivered babies. I'm sure most of the people listening to this have delivered babies. I have yet to find one that comes out a fully functional emergency doctor, right? Like nobody's ready to do this when they're born. All of us have to learn this as a skill. So how do we learn it as a skill? Well, I think the first part is we start talking about it like this, right? We start acknowledging that pressure plays a role in our ability to accomplish a task. And we ask each other, well, what did it feel like to you? What are the things that you did for it? And we start really becoming, like, to say something that again is a little bit corny, but I think really important, to become a scientist of ourself, right? To study our ability to perform under pressure, to start running experiments, both internally and externally. What I mean by that is, let's say you and I are working a shift together, right? I might say, hey, I am going to try this new technique today to handle the pressure when things get really hot. Can you feed back to me at the end of it? How do you think my control of the room was today? Did it feel different to you? Cool. All right. Yeah, of course. I'll talk to you about that. Right. And then we can use that as a way to jump off each other for it. Um, you know, mashing these two ideas together, right? Training under pressure and doing mental simulation, a great way to do your simulation of halo techniques, because you're going to have pressure when you're in a halo technique, is to do this visualization at the end of a workout. Your heart rate's up, you're sweaty, you're tired, you're flustered, then actually run through the mental simulation of doing this technique at that point in time, right? And put in there the stuff you're going to do in real life, right? If in real life you're going to do a particular breathing technique to slow your heart rate down before you do the procedure, do it. Do it right then, and then do the visualization. Did it work? Did it help you? Did it not? Right? Like it's a great simulated lab in order to do this kind of stuff. Now, for purists, it's not directly the same thing, right? And this type of stress does not equal the mental stress we feel under a life or death circumstance, but it's still pretty good. And I would totally encourage you to, do a set of burpees, sprint up a hill, and then visualize this procedure and see what it feels like. Because it's probably going to be a little different which parts feel fuzzy and which parts feel sharp.
Yeah, and the idea of physically recreating as much of that stress as you can without being in that situation
Mm-hmm.
will definitely enhance the sort of reality of the experience, I think.
Can I make so one caveat to that, right? What
Mm.
we know, and a lot of this work comes from the great stuff done by Eve Purdy and a lot of her team, including Victoria Brazel, is that you have to have you have to do that kind of training in a psychologically safe space. Okay, so if you're doing it yourself, that's fine. Please don't take your juniors, make them run an obstacle course, tell them that, like throw flashbangs in the room and then get them to simulate stuff unless you've already prepped them for how to do that. Right. There's ways to do this better and not. So take that with a grain of salt.
That you want to bring them with you and allow them to flourish rather than putting them off and
Exactly.
traumatizing them, for sure. So how do we, I mean, and I guess the other thing to talk about is that these sort of techniques that you are talking about, they are things that need to be developed. So there's a
Mm-hmm.
process in terms of how do you get good at doing this? Because creating a very real scenario mentally takes work in and of itself. It's it's not an easy thing to do off the bat. So how does one begin to sort of build that kind of practice?
Yeah. So let's build it up together, right? We're going to take a couple of layers and we're going to talk through at a high level what it would be like to build a mental simulation practice for a very specific halo technique, in this case, a crike. All right. And we'll give some broad brushstrokes and people can try this over the next little bit and see what feels good to them and where they want to work more. All right. So I'm going to learn how to do a crike. And first off, I'm going to separate the technical part from the pressure part. Right? We're going to separate those two things. So my first mental simulations are going to be zero pressure simulations, right? These are slow, low, and quiet. Okay. So I'm going to take in my mind, I'm just going to create a space. I'm going to close my eyes, keep them open if you want, but usually I'm going to close my eyes and I'm just going to think through the steps. And really I'm going to create in my mind sort of a disembodied head and neck, right? Which is all of the anatomy that I need to work for this. And I'm going to have my tools. They're all going to be laid in front of me. And I'm just going to set the stage like this. I'm going to visualize all of that. Then very slowly, I'm going to do the technique. Okay, my left hand starts. I find my landmarks, right? My right hand has a knife. I make an incision. I turn. I make a second incision. I bluntly dissect with my finger. I find the trachea. I ask for a bougie. I pass the bougie. I ask for a tube. I pass the tube. We demonstrate that it's in the right place. We demonstrate success. I stand back. Simple, slow, quiet like this. All right. Then I'm going to start speeding it up. Right. I'm not going to say the steps to myself. I'm just going to do them. I'm going to mentally close my eyes and I'm going to do the steps. Okay. What felt good in there? Did anything feel like I didn't know exactly what to do? And in this case, you're going to really pay attention to the small details. Do you know what it feels like with the pad of your left index finger to feel the cricothyroid membrane where you need to press? Do you know what it feels like? When you're doing the visualization, can you summon that feeling as you're doing it? All right, well, what about, what if you can't? Okay, well, you can go practice with people, right? You can go to your friend and say, hey, I'm really trying to get this. Can I feel your neck for a second, right? Ask permission before you do that, right? So you feel, you're finding out what you're doing it. And then you're going to go back and run it again. And anywhere in that visualization practice, the slow, low, quiet version that you don't feel perfect, you're going to go train. So sometimes that training is tactile or physical, right? Maybe you want to open the crike kit and make sure you know what's in there, what it feels like, what the different pieces are. Sometimes that training is intellectual. You're going to go watch a bunch of YouTube videos about how to do it. And sometimes it can be back and forth. So let's say that you've done a ton of crikes and I've never done one of them. I might talk you through my slow, low, and quiet version of it, right? And you can say, well, geez, Dan, the way you're describing your left hand placement probably isn't what I would do, right? I probably wouldn't come from the top. I'd probably come from the sternoclavicular notch and go up to find it. Oh, okay, awesome. Now I can incorporate that into my visualization. All right, so that's my layer one. Then I can speed it up. Right? I'm going to do it quicker. I'm not going to say the pieces out loud to myself. I'm just going to move with my hands and make it happen. And I'm going to speed it up and I'm going to speed it up and I'm going to speed it up until it gets to be about real speed for how I want it to be done, which is obviously very fast, right? If there are things I need to say, like bougie or tube or something like that, or folks, we're going to do a crike, whatever it is, right? I'm going to actually say that mentally. Personally, often I say those things out loud, right? Don't do this in front of people sometimes. You want to do this by yourself, right? But I'm going to say out loud, okay, I'm doing a crike. Okay, here's my steps. All right, bougie. Okay, tube, right? And I'm like doing those things in real time to get it done like that. Then I'm going to start expanding. Okay, so what does the world look like around me as I'm doing this? What's the situation in the room? Are there other things I can bring in to increase the richness and depth of my visualization? Are there things beeping? Are people yelling, right? Crikes are often incredibly bloody procedures, but when we think through them in a bloodless field, typically, right? So can I visualize blood? Can I visualize not seeing the anatomy and instead doing it with more of a tactile procedure, right? What if it doesn't quite work the first time? So then I start getting into that phase. Well, what if, how do I troubleshoot it? What if it's a little bit off? Or what if the person's a little tilted? Do I need to settle them? Do I need to reorient them to begin with in order to do it? And you can endlessly sort of iterate from there, right? And that those iterations might be, we need to do this with a C-collar on because it's a trauma patient. We need to do this in somebody who has a large neck or a goiter or had prior surgery or prior radiation, or geez, the bougie fell on the floor partway through. What do we do now? Right? Or you open the Crite kit and it's non-standard, and you can sort of iterate off in a space like that. That last part where you're really trying to stump yourself, that is actually pretty fun to do with a partner, right? So you and I are going to sit down, we're going to train Halo procedures today mentally. Okay, we're each going to go through our thing, and then we're going to throw a challenge at each other. And I might be like, all right, you're going to visualize one where you open the Crike kit and it only has a pair of Kellys in it, nothing else. Go. You're like, oh, okay, cool. What do I do? Right. We used to do this in residency. The strangest one we ever got to for one of them was you're in full hazmat gear because it's a chemical weapon attack. You're intubating somebody on the floor of a boat, and the boat's stabilizers have gone, so they're rocking. And so you're like, okay, well, like what? And, you're trying to get there. Anyway, that's an exaggeration. But the point is, you start very simple. You expand a little bit to make it faster. You increase the richness of the universe around you, and then you challenge yourself. And that's sort of how that would structure a visualization practice for doing a Halo.
That's really useful, and it's something I think that people can take away into their own departments as well. Our delegates today are from right across the region, so EDs that range from major trauma centres to smaller hospitals, so a whole range of different environments, and a whole range of people from some very senior experienced clinicians to people who are just starting out their careers in emergency medicine. So it'd be good to try and adopt some of these procedures locally. Hopefully there's something that people can take away and build upon.
Yeah, and the last thing I would say about that is that this works really well for yourself, right? Most ventral simulation is done by yourself. We've already talked a little bit about doing it in pairs or in teams, but I think doing it with your entire team is an amazing idea for this, right? So, especially if you take something larger like a thoracotomy, where it really involves the work of a lot of different individuals at the same time under pressure, right? This is a great one to visualize together as a team. And you might gather your team together in an empty trauma room, right? And say, hey, folks, we're going to collectively mentally simulate resuscitative thoracotomy on a trauma patient. Okay, and then just pick something. We have an 18-year-old male involved in a shooting. He has a gunshot wound to his left chest, penetrating trauma. He lost pulses right before he moved in. Okay, everybody real quick, close your eyes. What's your first move? Okay, open it, go around the room. Okay, what are you going to do first? What are you going to do first? What are you going to do first? And you can either do it as a stop and start like that, right? Where you step collectively, almost like an old school sort of what am I thinking about? Low frame rate camera, where it's like a staccato image over and over again like that. Or you can let everybody run through the whole procedure and mentally in their head, and then come back and say, okay, where did we have an issue? And then everybody talks through what happens. And what you're likely to highlight, or rather what that technique is particularly useful for, is to highlight differences in expectations around communication, around priorities, and around structure, right? So I might think the most important thing is getting the Finichettis set up in the right way, but you might think the most important thing is getting bilateral finger thoracostomies. So if that's true, then we've highlighted a difference that we need to understand so that we're all working with the same mental model. One of us might be expecting somebody to take the lead, and that person might not know they're supposed to do it. This is a great way to expose that. And then also kit and gear, right? So when we're doing this kind of a simulation, if we're saying out loud to ourselves, oh, and then, Dan will go get the thoracotomy kit. Dan's like, where's the thoracotomy kit? Right? Like, I thought it was over there, but when you go over there, there's nothing in that shelf, which happens like literally all the time. Right. So it's a great way to expose those sort of team and structural based dynamics when you're doing Halo work.
That's great. Thank you very much. I think that's really, really useful. And hopefully the beginnings of, an ongoing conversation that people can continue in this conference and beyond, to take it back to their departments and continue these discussions.
Absolutely. So as you do these stations, as you go through these, I would challenge you to think about how you would take that back to your team, right? How would you do the individual work? How would you do the small group teamwork? And how would you do the structural work around using mental simulation to improve your ability to do halos?
Brilliant. Thank you so much, Dan.
My pleasure. Thank you.